Once again, we're here at Performance Medicine in Kingsport. I'm joined by Dr. Tom Rogers. And Doctor, it's June and it is Men's Health Month. And men have some unique health issues, more so than women don't.
Exactly. You know, that's why I have this little lapel and the suit today, because
Right.
it's Men's Health Month. But probably my specialty over anything is men's health. I
Right.
love taking a middle-aged man and getting him in shape, teaching him how to eat, checking his hormone levels, doing the preventative measures. You know, contrast men to women.
Right.
You know, men die a lot earlier than women.
Right.
They are more obese, they have more diabetes, they have more hypertension, they have more cholesterol problems, they drink more, they smoke more, they commit suicide more, homicide. Men need to be careful, and the thing I find out is that men don't come to the doctor. They think they're too macho to get screened for some of this stuff. You know, it's really probably after, you know, I'm a 60-year-old man,
Right.
and I've been doing family practice for 30 years, so you see things, and there's patterns to everything. I think it's really harder to be a woman, to be honest with you,
Right.
but it's more dangerous to be a man.
I think men handle stress differently. And I think that has a lot to do with the health issues that men have.
I agree, they bottle it up. Women are
Right.
more likely to kind of express their emotions, and men bottle it up, and it has its toll on their health.
And when you talk about, there's certain tests, especially, I just recently, in the past few years turned 50 years old. That's kind of a magic age when you really need to crack down and watch certain areas of your body and get your prostate exams and other exams. What should men do, especially when they're in reaching those middle age?
That is a critical age, because men go into this period called andropause. It's just like a woman's menopause. It's just not as out in front.
Right.
But it's a slow decline, and when that testosterone level starts declining, you start declining in every way.
Right.
It's almost like nature saying to you, you're finished reproducing, start dying. The problem is we're living a long time, hopefully, so we have to look at the testosterone level. I usually recommend you screen your testosterone, you get a colonoscopy.
Right.
You really need to start getting your prostate checked at age 40,
Right.
not only with a PSA, but with a digital rectal exam. And following the numbers. It's not the absolute number, it's the velocity of that number change. You need to get screened for heart disease. You know, we have a panel here we run called a Boston Heart Panel, covered by insurance. That's a wonderful test that kind of delineates how big your cholesterol particles are, how sticky they are, how inflamed your body is. It also has some genetic testing on it, and also check testosterone and estrogen levels on men.
And we hear so many commercials anymore about low T, and you've explained some of what's going on there. How do you treat low T?
Well, there's one thing I'll tell you. There's two myths about testosterone. One thing I can absolutely tell you with certainty is testosterone does not cause heart disease.
Right.
It also does not cause prostate disease. Now, when you replace testosterone, you have to know what you're doing to make sure it's not bumping your red blood cell count up or converting to estradiol, which is bad for men. So as far as replacement, there's no pill for it.
Right.
You either have to use a daily cream or use a weekly injection, or I place pellets in the hip area and they dissolve over about 6 months' time. But you have to monitor things. You have to know what you're doing. Another thing is there's such a huge range of normal that you have to look at that normal in light of the symptoms.
So we're just relying on, if you start showing some symptoms, it may be too late. You can get ahead of all of this, can't you?
Well, it's not ever too late,
Yeah,
but the earlier you start, the better for sure. Your bones will be stronger, your brain will work better. It's not just for your libido or your muscles, it's for your health.
All right. And taking care of your health is what they're all about here at Performance Medicine in Kingsport. And you can find out more by checking on performancemedicine.net.